Well, let me introduce myself. My name is Jessica. I am the acupuncturist on board. I have been practicing acupuncture now for over 10 years. Like I said, I graduated from the Colorado Chinese Medicine University back in 2014. Then I ran my own practice for 9 years. Unfortunately, I had to close that due to the COVID situation. So I kind of took a sidestep in my career at that point and worked for 2 years as an orthopedic sales rep. But I missed the patient contact because by the time I got in the OR, the patient was already draped and they were out, and I didn't get a chance to really interact with them all that much, and I missed that. And I missed doing acupuncture. And then I am now here working on board. So I've been on this ship since November, and I have to say I absolutely love it. One of the main reasons that I love working on cruise ships more than I liked working on land was because it's better for my patients, to be quite honest. I mean, here, my patients can relax and stay relaxed. I mean, if you think about it, like you don't have to rush off to work to go get your errands done, drive home in traffic, like nothing. If you want to go take a nap, you can just walk back to your room and take a nap. You can go relax in the hot tub. You can do anything, and you can just maintain the relaxation. And on the ship, you're on vacation, you have time to devote to yourself and your health. So I find that being on board really has opened my eyes to what really is a healing environment for me and my patients. So it's been really nice to be working on board now. So today we're talking about arthritis and back pain. So let's all agree that your back is your workhorse of the body, right? It is designed to give you strength, to give you proper movement, good posture. It is full of muscles, bones, tendons, ligaments, nerves. It is in charge of pretty much everything in all of your movement and your core. And that makes it prone to injury. And it can be anything from the most minor irritation to something super debilitating, right? And when something is wrong with the back, it is loud and obnoxious, and all of a sudden, the simplest movements that you once took for granted become very, very challenging very quickly. And these are kind of the top 3 ways that pain can kind of come from. So it can come from the spine, right? Either through the bones. If there's a subluxation, that's usually when people go to the chiropractor, or there's a problem with the discs, either through degeneration, either from a bulge or a rupture of the discs. There can also be a thinning. There could also be a problem with the muscles, right? I mean, we've all done it where we've gone to lift something up and you feel that strain, or the amount of people that look like a shrimp all day long while they're at their desk. That just puts a ton of strain on the back muscles. And so you're going to feel that. And then there's nerves, right? I mean, coming out of the lumbar spine, you have your sciatic nerve. Coming out of the cervical spine, you have your brachial plexus. And those big nerve bundles control your limbs. And that's when, if there's pinching, most people feel it. And in the arm, there could be numbness and tingling down the arm. With the sciatic nerve, there tends to be more of that sharp shooting pain. It could be localized in the hip or even go all the way down to the foot. And so these are kind of the major ways that back pain is felt and what could be causing that. Now, arthritis is a term that tends to get thrown around a lot, mainly because I think people are now using it as a synonymous term for pain, right? Essentially, all this means is you have inflammation in a joint. That's all the term arthritis means, is inflammation in a joint. Now, that can be an acute thing or it can be a chronic thing. The chronic part is when it starts becoming a problem, right? An acute inflammatory response is actually a healthy response to an injury or damage that's been done to the tissue. Your body should bring some inflammation in to heal it. That's where all of your healing power is within that inflammation. But when it starts becoming chronic or stagnant or systemic, meaning within the entire body, that's when it starts becoming a problem. And at this point, I'm seeing arthritis becoming an epidemic issue, right? There's just over 100 different types. This is just a few of the types here. And it can be anything from the wear and tear osteoarthritis. Gout tends to be a common thing I see nowadays, especially in America. But a lot of these rheumatoid and lupus, fibromyalgia, a lot of these can be linked to, rheumatoid and lupus are autoimmune diseases. And I'm seeing a lot of increase in autoimmune diseases lately. Ankylosing spondylitis and fibromyalgia are, again, inflammatory issues within the body, and you're feeling pain. It could be localized, or fibromyalgia tends to be an overall full body inflammatory issue, and you're just feeling aches and pains everywhere. So arthritis is becoming a big issue on top of a lot of the pain that people are struggling with. Oh no, arthritis is not an age thing. It is not. To be quite honest, a lot of people assume arthritis is just because you're old, right? Like, oh, you're just going to develop it because it's an age-related thing. It is not. It is more related to lifestyle and diet. To be quite honest, it's more of a diet issue. You could get ankylosing spondylitis, lupus, rheumatoid arthritis, fibromyalgia, all of those things. I know people that have them in their 20s. It has nothing to do with age. That's the unfortunate thing, is I think that Western medicine is using this term far too much, because then people are getting this idea that, oh, I'm old, so I just have to learn to live with pain now because I have arthritis. That's what everybody has, right? It's just, but there's no solution, right? Because if it's just age related, then there's nothing you can do about it, right? That's the idea that they're putting in people's heads, and that's very wrong. So here's some examples, and this is how most joints are put together, right? You have two articulating bones, both of which have cartilage on either end. The joint is put in a little capsule surrounded by tendons and ligaments. And then within that joint is synovial fluid, which tends to be the kind of oil, right? Like if you think about it like in that way, it's the fluid, the oil that keeps that joint mobile. On top of that, you have a muscle. And in most of the major joints, like your shoulder, your hip, and your knee, there is a bursa. This is the other itis that I'm hearing about, is bursitis, right? There's a lot of people that have inflammation in their bursa sac. And the bursa is very similar to how your discs, it's very similar tissue to how the discs in your spine are put together. And all it's doing, all it's there for, is to help be a little cushion between your bone and your muscle, so that your muscle isn't grinding against your bone when you're doing any kind of movement. It's there as protection. Now, as you see here, the osteoarthritis is more of the wear and tear arthritis. So at that point, there's a breakdown in the cartilage. There can be inflammation or pressure put on the bursa, and there's now possibly some loss of that synovial fluid. And that's when you're going to get that stiffness, that achiness, possible grinding, popping, sounds, feels. That's usually what's happening there. Now, unlike this, the rheumatoid arthritis, like I mentioned before, is an autoimmune disease, right? So it's going to present very differently. Rather than a degeneration, you're going to see major inflammation. You will see it in the joints. They're going to get big, they're going to get puffy, they're going to get large, hot. They can potentially be red. And unlike osteoarthritis, which tends to be maybe on just one joint or another, rheumatoid arthritis is going to be bilateral because it's affecting the whole body. In an autoimmune disease, what's happening is the body is actually attacking itself. In this case, the joints specifically. Now, granted, yes, Western medicine is fantastic when it comes to diagnostics. We've got x-rays, MRIs, CT scans, you name it. They can test your blood to see if you've got autoimmune markers. They've got all sorts of tests. The problem is when it comes to back pain, arthritis, there's no such thing as a pain machine. They can't just hook you up and say, ah, yes, I see you have level 4 back pain at the moment. They can't do that. Because they can't do that, the option for treatment is send you home with anti-inflammatory drugs or pain meds, which have all sorts of side effects and limitations. If that doesn't work, then they're going to do a steroid injection. Cortisone is the popular one, right? And the only reason why that might work momentarily is because when you inject cortisone into someone, anything that it touches, it kills. So it kills your nerve. That's essentially what's happening. Cortisone, they know that it's destroying the tissue, which is why you're only allowed to have 3 in one area. They know it. They're just still injecting it into people as a quick fix. And if all of that fails, then they're going to tell you surgery. That's what they've got. And the reason antidepressants are on this list is because when someone's been in chronic pain, it's depressing. Like, pain is fatiguing. It's exhausting. Just one day sucks. I can't imagine what people go through when they've gone decades with chronic back pain or neck pain. Like, I can't imagine. So I know that antidepressants are widely used because people in chronic pain need them. Now, traditional Chinese medicine has been around for 30 centuries at this point and counting. And now it's starting to catch on. Like I said, insurance is now starting to cover it for pain management. It is now in major medical institutions like Massachusetts General, Harvard and Stanford, and Cedars-Sinai, and the Mayo Clinic. And even the VA is now covering it. I was working on a lot of vets with for pain management. So the VA is now covering it as well, which is fantastic. And there are no side effects. Since 1997, the National Institute of Health has officially acknowledged the efficacy of acupuncture. And the amount of research has just compounded since then. But there are tons of studies to show its effect on the central nervous system. So while the rest of the world is evolving and moving at such a fast pace, unfortunately, our nervous system is still extremely primitive. You are either in fight or flight, or you are in rest and digest. It is that black and white. There is nothing in the middle. There's no half relaxed. And because of that, that will trigger what the rest of your body and what the rest of your organs are doing. So unfortunately, the fight or flight response was once just designed to save us from a bear, from running away from danger, fighting off an enemy, whatever it was. It was there as a survival mechanism. Now most people sit in that state for 8 hours a day, unfortunately. And what that does when your nervous system is triggered in the fight or flight response, it's telling your heart to speed up. It's telling your liver to kick out a bunch of glucose. Just in case you haven't eaten in a while, you'll have energy to fight or run. It will tell your digestive system to slow down. It will tell your kidneys to slow down and stop functioning. It's going to tell your adrenal glands to start kicking out a bunch of stress hormones like cortisol and adrenaline. And for a lot of people who are struggling with extra weight gain, especially belly fat, there's tons of studies to show that high levels of cortisol in the system, that's a major contributing factor for that. So what acupuncture will do is take you out of fight or flight and put you back in rest and digest. So now your nervous system can calm down and tell all of your organs to start functioning at a more optimal, healthy level. In addition to that, it's going to stimulate your endorphins, which are your body's natural painkillers, which is why it interrupts the pain signal. In addition, it stimulates neurotransmitters, which are your body's natural mood regulators, and it will help you then manage stress levels. Now, this term, homeostasis, is one of my favorite terms. All it means is balance. Your body is constantly, through chemical reactions, through nervous responses, through all of the different systems going on and acting all at once, is constantly trying to put itself back into balance. And acupuncture just helps facilitate that faster. And by doing that, we're tapping into your body's natural healing mechanism, and it starts facilitating your healing quicker. On top of that, it increases your circulatory system, so it increases the circulation all over your body, and it increases your immune system, making you more resilient to illness and helping you improve in your healing. Because let's face it, the only thing that's going to heal you is your blood. Oh yeah. I mean, your body put inflammation in that joint. It can take it away. Just like look at this picture. Bone spurs, your body put extra bone there for a reason, because it felt like it needed it. If your body put it there, your body can take it away. Yeah, I know. That's what a lot of Western doctors are saying, because they don't have a way of treating it. That's the problem. They're telling people that they have to just learn to live with it because they don't have a way of treating it. And most doctors, honestly, like I said earlier, arthritis is more related to lifestyle and diet. Your general practitioner, your PCP, the chances that they have any nutritional education at all is very slim. Very slim. In fact, most PCPs and even most surgeons have maybe taken 3 credit hours of nutrition. That's less than 1 class. Even cardiologists don't take nutrition, and yet they're out there telling people how to eat and what to eat. They have no education on this whatsoever. And they're not sending people to a nutritionist. And even if they do, the nutritionist isn't going to look at you as a whole person. Most people go to a nutritionist because of one common symptom. Either they want to lose weight or they have an issue with their heart. Very few people are going to go to a nutritionist because they have arthritis, right? Even though that's a major factor. The first thing I tell people when they tell me they have arthritis is I say, okay, get rid of all dairy in your diet. Every last bit of it. No dairy, no sugar. Dairy is the biggest inflammatory. So that's the first thing I tell people. If you are struggling with arthritic pain, get rid of dairy. Especially if you are someone that knows you are feeling it in your joints when the weather's changing. Your body put the inflammation there because it felt it needed it. If it doesn't think it needs it anymore, or if you're not eating something that's activating this inflammatory response, then the inflammation goes away. So on top of that, yes, traditional Chinese medicine also incorporates Chinese herbs. And one of the main reasons why is we learn from Hippocrates, let medicine be thy food, let food be thy medicine. I mean, that's the second one to maintain your health, is getting proper nutrition. Your joints, your muscles, your tendons, your ligaments, like your heart, like your whole body needs proper nutrition. And sometimes no one's going up to the buffet and thinking, okay, I'm going to take this because my heart needs it. I'm going to take this because my liver needs it. I'm going to take this because my digestive system needs it. Nobody puts food on their plate with that in their mind, right? But as a Chinese herbalist, that's what I'm putting prescriptions together for, is I'm putting herbs specifically together with the thought of you need help with your joints, your tendons, inflammation, supporting your health in your heart, your liver, your kidneys, whatever it is. That's the idea, is we're putting together specific formulas for you, for each individual patient. So this is a nice list. This is the World Health Organization's list. Acupuncture is proven to be effective in treating over 100 different conditions. What I tend to work on the most is stress and pain. Women's health tends to be a really big one as well. Nobody needs to learn to live with hot flashes either. Just like you don't need to learn to live with pain. Like, it is my philosophy that I don't think anyone should learn to live with any discomfort whatsoever. I do tend to work on a lot of digestive stuff, especially on board now that we're at sea. This is very calm, but when we go through the Drake's Passage, the water might get very choppy. There might be a lot of people that get seasick, and that tends to be a big one for me. I actually just worked last cruise, I worked with a lady who had Meniere's disease, which is essentially chronic, horrible dizziness and nausea. Like she couldn't even on land, she couldn't even turn over in bed without getting sick. And so we preemptively treated her. I did 5 treatments on her. I preemptively worked on her prior to us getting to Drake's Passage, and then 2 more times after that. She never got sick the entire time. She was even able, with her husband, to go on this awesome, fun 4-wheeling excursion, off-roading in Stanley. And he was like, oh, she's like, this is great. It was awesome. She came back in, she was practically in tears. She's like, I've never felt this good. I've never not been sick. For me, in my practice, I don't just have people come in and I passively put needles in them and send them on their way. I want to work with them and see where they're not managing their health. Usually, if somebody's health is deteriorating, it's because of one of these 5 areas, one of these 5 key areas. So I want to help them fix those so that I can get them back on the right track, get them to the healthy level they want to be, and then give them all the tools that they need to maintain their health. And that's always my goal.